The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us, we have an expert on the topic, periodontist Dr. Crivello. Dr. Crivello, welcome to the program.
Thank you, Randy. It's a pleasure to be here.
All right, now, before we get into today's topic, tell me a little bit about your center. You work with a team of periodontists.
That's right. That's right.
And tell me about the practice, what you do there, what are the different procedures?
Well, our practice is located in Pasadena. It was established about 30 years ago, a little bit more than 30 years ago. We are a group practice. We have 3 periodontists in the practice. There's Dr. Charles, Dr. Morishita.
I've met Dr. Charles.
And myself. And we've recently moved to a new facility about 4 years ago. And in that facility, we have some technical advantage.
Now, all 3 of you do the same things.
That's right, Randy. We're all periodontists. We all been trained the same way, and we use the technology in our office all the same way.
You have all the new stuff, you see.
We have all the new stuff. We have a CT scan unit, which allows us to take 3D images of our patients. We use microscopes as much as we can. So it's great. It's fun to be able to give these treatment options to our patients.
In the future, do you think, when I hear slogans like no more dentures, is that the future of dentistry, you think?
It's going that way, Randy. I mean, patients, that option exists. And the real thing that we're trying to do is get that option familiar to people so that they know that that option exists. And I think we are going towards a denture-free society. If possible, it'd be great. That's what we want to do.
Now, moving on to the topic of dental implants. Why is it that what used to take you guys 8 months or 12 months for dental implants now could be done in a visit or 2, where they leave with teeth?
Right. Well, I think there are 2 parts to that. I think the first part is that the implant surfaces, the technology around implants has just improved so much.
Okay.
It's wonderful we can do. The second part is our part, the clinical part. I think we've gotten so good at treating patients. We talk about 3D imaging, about guided surgery.
What we
can do today, Randy, is a patient could come in, we can take a scan of their jaw, and we can actually pre-plan the surgery before the patient ever comes in for the treatment. And so we know exactly where we're going. There's no guesswork. We know where those implants are going to be placed precisely.
So what, it's less cutting than there was before?
Absolutely.
That's why there's less pain?
That's a possibility. With guided surgery, if you know where you're going, you don't need to push back the gums and visualize the bone. You do it on the scan. And we like to call that minimally invasive surgery. It's minimally invasive. We don't push back the gum. Patients heal great after it. There's a lot less downtime afterwards, and it's a wonderful thing to provide for our patients.
People don't like going to the dentist. Do you still hear that? Do you hear people saying, I don't like the dentist?
Maybe when they first come, but our practice has really been...
do they say that to you, though?
I've heard it from time to time.
Okay.
But our practice has really been targeting a patient-centered approach. We really want our patients to come. We know they'd rather be somewhere else, but we want them to come in.
That's for sure.
We want them to come in, really feel comfortable. We have a great team. And usually by the end of that first visit, they're feeling really comfortable, and they're happy to come and see us. So
what are the different categories of dental implant patients that you see?
Well, we see a couple of categories. We see the patient that comes in with 1 missing tooth. We see the patient with 2 to 3 to 4 missing teeth. We see patients that come in wearing dentures. They may have just had their dentures given to them, or they may have had dentures for 30, 40 years, not knowing that dental implants was even an option. And we have some patients that come in, that due to certain events haven't been able to take care of their mouths, and they come in looking for a whole new solution. And oftentimes these patients need to lose a lot or all of their teeth. And so they fall into that dental, that denture
Are there a lot of people that do nothing? That means that their teeth are loose and and they just they know they have to go, but they don't do anything.
I think that's a portion of the population. I think we're getting away from that. I know that a lot of people have the mindset that they don't want to go to the dentist, the pain, things like that. But I think we are moving towards a population that's more aware of what's possible. But I do see the patient that comes in who hasn't seen a dentist in several years, and they come and see us, and we want to help those people.
Now, by the way, how big of a problem is, okay, so we're talking about denture wearers today too, what, some of the benefits that they could, they get from dental implants. But, are there thousands of people in just LA alone where your practice is?
Tens of thousands.
That are wearing dentures.
Tens of thousands.
That don't have to be.
That don't have to be. They don't have to be wearing those dentures, and we want to get that information out to them. I think one of the problems is they're just not aware of this solution. I mean, I think there are some misconceptions.
Why is that? Why is that?
You know, and this is just my thought, but I think once a patient, you know, starts using a denture, they may go visit their dentists less frequently. Technology, dentistry has changed. So
they don't go to the dentist?
They usually go for emergency, you know, a denture reline, but they probably won't go as regularly as a person who has their teeth. And so technology has changed, implant dentistry has changed, and they may not have been informed about their options. So I think that's one of the limiting factors or barricades for these patients, one of these blocks.
You know, I told this to another dentist, you know, in one of my programs, that my mother, who's 74, has been wearing a denture since she was 30. Right. And she says, Randy, my medical doctor said I'm too old for dental implants. They may fall out. And you guys say that's usually not the case if somebody's pretty healthy.
Right. I mean, we get that question, and I love that question. The question is, am I a candidate for a dental implant? I love that question because my answer is always yes. You're a perfect candidate. The truth is the majority of people are perfect candidates.
I mean, unless you're in cancer treatment or current treatment, you can get dental implants?
There are patients that are not good candidates for dental implants, and we screen in our first initial visit, and we explain to those patients why they may not be. But for the vast majority of people that we see, they're perfect candidates for dental implants. Age is not a factor. We see patients well into their 80s, early 90s.
Now, why would a 90-year-old want to get dental implants?
I mean, a quality of life, Randy. It's quality of life. We have a patient in the practice that was treated by one of the other docs in the practice, 91 years old. And the patient came in and had a bridge in the back part of his upper teeth, of his upper mouth. And he came in wanting a solution because he had broken the bridge. And it was recommended to him by one of his dentists to replace it with a partial denture, something you would remove and put in the day. And the patient just couldn't chew. And he turned to one of the partners and said, well, why would I do that now? I'm 91 years old. I haven't worn a partial denture to this point. Why would I start now? I want something fixed. And that's what was done. We placed 2 implants for this patient. We replaced that missing area of his mouth, and he was able to chew. Now, he's an optimist. He came in for his 3-year post-op. 94 years old, came in. We took a look, made sure the dental implants were doing well, and we were happy to know that 6 months prior to that, he had just gotten married. And
because of his dental implant.
Perhaps. I'm not going to chew.
But this is interesting. 91 years old. I mean, it's got to be painful at that age to get dental implants.
Well, that's another one of my favorite questions. Does it hurt? Because that's another misconception and another block to dental implants. Dental implants are virtually pain-free. It's one of the treatments that we provide to patients that is virtually pain-free. I mean, the truth is, the bone doesn't have any pain nerve endings in it.
Okay, good.
So there's no pain associated with the procedure. Patients are frozen. We freeze up the area as if you were getting a dental filling. And afterwards, the great part afterwards is that virtually no pain.
So they get, so a denture wearer goes in, they get some of these procedures that you do. They leave with a set of teeth. They have medications.
We give them
pain medications. But the next day, what's going on?
The next day, maybe some patients, an Advil, a Motrin, a lot of them, no pain medications. Of course, we provide them, but it's unbelievable how many of our patients don't use pain medication afterwards. We're talking the next day.
So no more dentures. Okay, so I mean, you know, when I hear this, as little as 2 dental implants for a denture wearer.
As little as
snap in, snap out?
Absolutely, and we're moving towards that being the standard of care. We're really moving away from lower dentures. They move, they hurt, they come out when you don't want them to. You have to excuse yourself after meals. It's just not okay today to have that for a patient when we have other options. I mean, I can show you an example.
Yeah, let's take a look.
I have an example here. This is just a model. And I can give you a story. I had a patient that came in. He was told that he needed to have his teeth out. And so the denture was delivered to him. And I saw him about 5 years after he had the denture delivered. And he came in and see me and said, can you help me? My life has changed drastically since I've had these dentures. I'm just miserable. I can't have my wife's home-cooked meals anymore. I can't taste them. I can't bite into anything. And I said, of course we can help you. Absolutely. We placed 2 dental implants for this gentleman on the lower jaw. Right in here, as you can see on the model. So what we have here is an example. It's a model of placing 2 dental implants in the lower jaw. I can't even get this off myself.
Exaggerating a little bit then?
No, not at all.
Okay.
Place 2 dental implants in the bottom. Oftentimes use the same existing denture, modify the denture. You can see the 2 snaps on the inside.
Yeah, let's show that for the camera.
Absolutely.
Okay, good. So that's what it would look like. That's an actual...
That's very similar to what it would look like. And this denture would then be able to be snapped into place.
Let me take a look at that.
Fixed.
Is this an actual, I mean, this is what...
I mean, that's basically what we're looking at.
I'm not exaggerating. Okay, so...
Yeah, I mean, it's really
so
stable.
Bottom of the mouth.
Bottom of the mouth.
To here.
Denture sits
no
on
adhesive.
it.
So they don't need any adhesive even for the back.
That's one of the great things. No adhesive.
Okay.
No more dental adhesive. No dental glue. This can be placed, fixed in place. And, you know, I followed up the patient, as I do all my patients, and every time he came in, it was always the same thing. We always started with, thank you. Thank you for allowing me to eat again, to function again.
Is this one of those things that they say, I should have done this years ago?
Absolutely. Probably the most common thing we hear, especially patients with denture, because they've gone through 10, 20 years of wearing dentures, some of them not knowing the possibilities. You do this type of thing for them, and they're just so grateful, and they wish they had done it years ago.
Is that right? And so they're never left without teeth nowadays?
Absolutely. Most of the procedures that we do, the patient receives the denture the same day, or the teeth the same day.
So when people are missing 3 and 4 teeth, maybe they have old dentistry in their mouth, okay, so it's getting loose. Because, is that true? I mean, partials or bridges, how long do they last?
It depends on the studies that you read, but, you know, anywhere from 7 to 15 years in that range.
So this may even be less in the long run, instead of, you know, especially with failed root canals and things like that, that just to replace your teeth with dental implants.
Right. And you know, one of the proven procedures in dentistry is bridge work. I can show. I brought this model.
What
here
is
if I can show
Let's
this.
take a look at this.
So what we're looking at here is some of the traditional dentistry that we've had in the past for a missing tooth. Traditionally, what we would do is we would shave down the 2 adjacent teeth from where the tooth was missing, and we would deliver what we call a bridge, and that would solve the problem with the missing tooth. Of course, by doing that, we have to shave down the 2 adjacent teeth. Sometimes that caused the need for a root canal. When instead today, what we can do is if we place these teeth back in place, we can place a single implant right between the 2 teeth, and we can deliver a tooth. And now we don't have to cut into the 2 adjacent teeth, and the patient has the missing tooth back.
And it will last as long as any other tooth will last.
Absolutely.
Maybe longer.
Absolutely. Studies show that, you know, success rates with implants, 95 to 98%, depending on what study you read.
What if you're in your 80s or 70s and you have a little bit of osteoporosis? Still a candidate?
Absolutely. Absolutely. Still a candidate. Implants placed in patients with osteoporosis tend to do as well as implants placed in patients that don't have osteoporosis. So this is still a great treatment option.
Is there a preventive part, like people missing 3 and 4 teeth? Why get dental implants over traditional dentistry? I mean, could it prevent possible future tooth loss?
Well, you know, one of the things about losing teeth is the bone that's around the teeth is maintained because of the tooth. The pressure and forces on the teeth maintain the bone. So when you lose a tooth, that bone tends to collapse. What a dental implant does is not only does it replace the missing tooth, but it gives function to the bone. It gives the pressure onto the bone, and it keeps the bone and maintains the bone there. And it prevents the facial collapse that we see with some patients.
Now, denture wearers, you have this very interesting photograph, if you could show that, where when a denture wearer loses their teeth, you say they lose bone and their nose gets closer to their chin.
Right, and
show this.
This is a sketch. This is an animation of that, exaggerating the fact a little bit. But when you see this patient from a profile view, you can see that a patient with their teeth, and then after losing some teeth, you can start to see the collapse of the chin, the collapse of the cheeks, the lines forming on the side.
So every denture wearer is headed for this. I mean, are they losing bone? Is that
and what's happening is that the bone's being lost. It's not being used, so you have disuse atrophy. And what's happening is that the jawbone is shrinking. And as a consequence, the facial draping is what we see here.
We're going to take a quick break. We come back, more about the process. What happens on day one. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking about dental implants and what you need to know. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're here with Dr. Crivello, and he is a periodontist. We're discussing what every denture wearer needs to know about dental implants. He says with as little as 2 dental implants, you can get a full set of teeth that can snap in, snap out, no more adhesive. That's true.
Correct.
Just 2 implants.
Sure.
Done in maybe a couple of visits.
Couple of visits, sometimes done in 1 visit, Randy.
Really? Mm-hmm. So when I hear these things like teeth in a day, things like that, they just can do one visit? And I mean, how does that work out?
Oftentimes, patients will come in, for example, the patient that's wearing a denture, an existing denture, unhappy with the fit. It's loose, it's moving around, there's pain, they can't taste like they used to. They just lost that self-confidence. They want to come in, they want to get something fixed, something that stays in place. Well, what they'll do is they'll come in, we'll place the 2 implants in the lower jaw, and we will oftentimes modify the denture that day, and we will actually place the denture onto those implants, snap in, same day. They leave with the teeth in place.
I mean, wouldn't it be, I mean, isn't it really 2 appointments? I mean, so you could do the imaging the same day, you can use their existing denture, 2 implants, and they're ready to go.
Right.
How soon can they eat, by the way?
Well, for some patients, they can eat the same day. We tend to take, we like them to be on a soft diet maybe for a day or 2, but technically some patients can eat the same day with the denture in place.
So the fixed, though, it sounds like everybody would want something that doesn't come in and out. So how many implants for that?
The fixed is a great solution for these patients. 4 or 5 implants on the lower, 4 to 5 implants on the upper, depending on the situation. And here we have teeth that are permanently in place. You don't have to take them out.
Do they feel like their own teeth, do they say?
Absolutely. I mean, again, the taste is back. They don't have the plastic that covers the palate because we don't need that anymore because they're fixed in place. So they have their taste back. And it's wonderful. They don't have to remove it at night. They don't have to clean the denture. They can clean under the fixed restoration that we've given them, the permanent restoration.
And they're white? I mean, cosmetic looking?
Aesthetically, we can do
I can spot dentures walking down the street.
It'll be difficult to spot these. A lot of them are made out of ceramic, beautiful colors. We're giving back natural looking smiles. A lot of patients come in with photos that, you know, the way their teeth used to look. We try and match that, and we can a lot of the times, or we try our best to, and patients are really satisfied. They're really happy with this.
Do they smile more when it's all done?
Absolutely.
Because you said, you know, I love it. We're on the couch over there. We're talking prior to the interview. You said this is more than just about implants. This is about getting a smile you used to have. Elaborate on that.
It's wonderful. I mean, patients come in, they've lost part of their body, they've lost some teeth. You're able to give them back teeth. You're able to give them back a smile. Smile equals confidence equals increased quality of life, better quality of life. They're able to go out, interact with their friends, professionally, socially. They're able to smile. You've given back their teeth. It's wonderful.
So they brush them the same way?
Water pick under, around the implants. Keep the implants clean.
What about floss?
Floss can go under, between the gum and the
Are there
teeth.
porcelain options?
Porcelain options where, you know, again, the aesthetics, cosmetically wonderful because it's porcelain. You won't be able to spot it. It's great. It's a great option for patients.
Is there more women that do this?
It can be. Women tend to come in a little sooner. Some men, and I don't want to generalize, but some may wait a little bit longer till things start to hurt, and they may put it off for a lot of different reasons. We do see a lot of women, but we also see a lot of men. And like I said, we're giving back a smile. That's for everyone. That's not gender specific.
And you'll work with their own dentist, right? They don't need a referral to see you. I mean, they could call you directly.
They can call us directly. We're lucky in Pasadena. We're working with some great general dentists, some great prosthodontists, and a lot of these dentists will refer these patients to us. But yeah, sure, they can contact us directly.
What are the misconceptions about dental implants that you hear from patients maybe?
The most common misconception that I hear is probably, am I a candidate for dental implants? I didn't think I was.
I was too old.
I was too old, I didn't have enough bone, I didn't have enough gum tissue, all these reasons. And the truth is that there are very few patients that can have dental implants for those reasons.
My son's dentist, he's 19, missing a tooth, said that the problem with dental implants, they fall out.
Well, is
that kind of silly?
Studies don't show that. Studies show that.
That's a true story, by the way.
Yeah, no, dental implants, you know, if you look at the studies, 95 to 98% success rate, they do well. Implants do well. And our goal, once they're integrated, is for them to be in place for life. We don't expect to go back and change them. We want them to be there, a permanent fixture for the patient.
What do they want to know? Okay, so here's the consult. They see you, they probably say, are you the periodontist, right? Because you look so young. And you then tell them yes, right?
Yeah.
Okay, I'm joking here. But I mean, what do they want to know? What are the frequently asked questions?
Usually the first question, like we talked about, are dental implants for me? The second most common one is it going to hurt?
Yeah.
And again,
it's painful, very painful.
Well, it's a great question because it's a great answer. And the answer is virtually pain-free, virtually painless.
Okay.
These patients do well after we're done. Very minimal pain medications. Of course, we provide it, but most patients couple Advil the next day, a Motrin here and there, and that's really...
So what do they want? Do they want IV sedation or oral sedation?
Well, we provide both, and I think it's great. They tend to like oral sedation in our area. We don't have that many patients that request IV sedation. It is an option for them, but IV sedation, when indicated, is great.
So the oral sedation, I mean, they forget they even had the procedure done, I've heard? Is that
Especially after IV sedation, you will forget the procedure, oral sedation to a certain degree, and it's wonderful for patients because they won't feel anything during the treatment because they're numb and there's very little pain associated with it, and oftentimes they'll forget about the procedure. So they've left, they have teeth, and they feel like they haven't gone through anything. It's
costs, wonderful. Going into this, I mean, do you think people count their teeth?
Right.
And think, wow, this is going to be a lot of money.
That's another...
But with 2 dental implants, you're saying...
Yeah, and that's another huge misconception, cost. That's another question we get at the initial consultation. How much will this cost? Is it going to be a fortune? The truth is that dental implants are affordable.
In the long run, is it less if you started early?
Yeah, and
is that your opinion?
I mean, that's a good question. It depends, but if you look at the cost of replacing a tooth with an implant versus replacing a tooth with a bridge, and now we're talking about root canals, the costs are very comparable. And so in that aspect, they're comparable. The other question becomes, do I have to replace every tooth with an implant? Because I'm counting my teeth, and that's a lot of implants. The truth is, no, we don't have to replace every tooth with an implant. We can, we don't need to.
Okay, you're a specialist, by the way, and we're just about out of time. Does it cost more to go to a specialist? Because I guess general dentists could do, the placement, the restoration, etc.
Right. Not that I'm aware of. We don't charge more or intend to charge more than everyone else. I think it's pretty comparable.
And that's what I've been told. On this program, this is a real interview, and people on our website on wellnesshour.com email me, and they want referrals. And we always let them know on a reply that we're not a referring website. Right. But I say go to a specialist every time, no matter what it is, whether it's a heart guy, a knee guy, or whatever.
Right.
Same thing here. I mean, you have a bias, obviously.
Well, I mean,
should they go to a periodontist, do you think?
Again, I am biased.
It's the same price whether you go.
I mean, we do have the extra surgical training. A huge emphasis of our graduate school training, which is the 2 to 3 years after dental school, is on dental implants. So we really deal with dental implants a lot of the time. And so we've seen a lot of them. We know how to treatment plan them, and it's a great question. And I guess that'll depend on the patient and the area that you're in, but I don't think as far as cost goes that there's a huge difference between.
Yeah, I mean everybody's paying about the same.
Correct.
So you might as well go to a specialist. They don't have to switch dentists, but if you're a denture wearer, you usually don't have a dentist.
Right, and we work with the dentist. That's the great thing. It's teamwork. We do one aspect of it, and the dentist, they can stay with their dentist. They do the other aspect of it, and it's great. It works out really well.
And then the patients that have been told your teeth have to go, or they're afraid of the dentist altogether. They're doing nothing. What do you say to them? They're watching this. They're highly anxious. They know their teeth have to come out.
Well, I'd love for them to see this show and go see their dentist and see what their options are. Okay. They may have options that they're not aware of.
What if their gums are too bad, though?
Well, we can treat that. And oftentimes if the tooth...
How do you treat that?
Well, if the tooth is the cause of the gum disease and we remove the tooth, then that gum disease is settled. We can treat gum disease. That's what periodontists do most part of the time. We treat periodontal or gum disease. And once that's taken care of, we're ready to move
so the gums get healthy.
Implants. Absolutely.
Can you be too far gone, by the way? 40s, 50s, 60s, your teeth are such a mess. You can't be too far gone to get some dental implants?
Absolutely not. And again, that's what I want to reiterate to everyone, that dental implants are great because they're for everyone. Everyone is a potential great candidate for dental implants.
So they get their teeth back, their lives change.
Absolutely. Quality of life, way up.
They're more active, they're dating.
More active, they're able to go out, they don't have to worry about things.
They're smiling more?
They can start smiling. I mean, a smile will change your life. If you're
How important do you think the smile is?
I think it's one of the most important things that we can do. I mean, it just shows the patient's character. You're able to really, and friendliness as well. Some people don't feel comfortable with their smile, and so they frown a lot or they hide their teeth, and they may come off as cold or unapproachable or something like that, but you give them their teeth back and they're able to smile again, and it just changes their life.
Now, you brought a photo. We didn't even get to it.
I did.
What is this?
We have a patient that came and see us. When she came, she was told that she needed to lose her lower teeth.
All right.
And she just didn't want anything that she had to remove from her mouth. So what we did for this lady is we removed the teeth and we placed 4 dental implants on the lower in the same day. And she later received a lower fixed, standard, in-place denture.
Okay.
She went home, went about her life. She had a partial denture on the upper. She called us back 6 months later and said, you know what you guys did for the bottom? Can you do that for the top? Because she got a comparison. She saw what she could have compared to what she had. So she came back in. We did the same thing for this lady for the upper jaw.
Let's take a look here.
And she was just as happy.
So these are
as
dental
could be.
implants.
Those are dental implants.
Very nice.
Well, the great thing about this, Randy, is that, yeah, it looks great. It's very natural. It's age appropriate. You can see the front teeth there on the final product. But the wonderful thing is that before she came and see us, she had lost function. She wasn't able to taste food because she had the plastic going on the palate. And after we were done, function was back, taste was back.
Function meaning what?
She could chew, she could eat, she didn't have to worry about biting into corn, into steak, into bread. None of that. That was a thing of the past for her. She was now with teeth and ready to go out, meet people, and have a great social and professional life.
Great stuff. This is good. And I'm sure there's a lot of people like her.
Hundreds.
So
Absolutely.
if you're a denture wearer and you're watching this, what could be the turnaround time in an ideal situation? You're in your 70s. If they called your office and saw you today, how soon can they have a fixed set of teeth, if everything goes well?
Absolutely. We come in, they'll come and see us.
But like a month from now?
We'll take a scan. A month from now, they can be sitting down with dental implants and something that's stable and that remains
Eating
in the
corn on the
mouth.
cob?
Eating corn on the cob.
Could they chew on a tire? I'm kidding.
If they wanted to.
If they wanted to. Well, thank you for coming to the show.
Thank you
Good
so much.
stuff.
It's a
Good
pleasure
stuff.
to be here.
You've been watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again or direct a friend to it, you can visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.